Hey guys, this is Ramya Ramsi here, and we are back with another interview from Dr. Sridharan sir. This is part of the Asthma and Allergy Resource Center that he runs, and he's been doing it for several years, and it's so successful, and we would love to hear more about that. So thank you so much for accepting to do this
Thank you.
interview.
Thank you.
This interview will be completely in English, as per our last Tamil interview that was focused on the Tamil audience, and today, for those of you who don't understand Tamil, we have a complete English interview.
Thank you.
Shall we get started with the questions?
Sure.
Okay. So, my first question is, we just learned about your Karpaga Swasalaya charity trust. Could you expand on this a bit?
Yeah, sure. Recently, we have launched a free asthma care service, which is called Karpaga Swasalaya. We have been giving free comprehensive asthma care for all our poor patients in a non-traditional way. It's not like structured. It used to be called Karpambal Asthma Charity Organization. Now we got a very fine new logo where we are depicting the lungs. On one side of the lung there's the Karpagambal, the other side is a peacock, because as we all know, Mylapore, the great place, which is a very divine city in Chennai, we have Karpagambal, who is here as a peacock doing penance towards Shiva, and she attains Shiva. So we got a lung that depicts Ambal on one side and peacock on one side, and in the center we are depicting a Shiva Linga. This is to kind of convey the message that our lungs are very special. Our whole body is very special because this is given by God. So every part of our body is very divine, and we need to take care of that. To convey that message, we got very divine images in the lungs, and we call it Karpaga Swasalaya, which actually means a temple of breathing. Swasam is breathing, Alaya is temple. You all probably know about Shankara Netralaya, which is actually like a temple for the eyes and the vision, which is run very successfully, and it's a very noble charity organization in Chennai, which is world famous. Our intention and our desire is our Karpaga Swasalaya should also attain name and fame, recognition and acceptance from all the people, so that we can deliver free asthma care, a good quality care, a comprehensive asthma care for all the less privileged ones, the poor patients who are plenty. Already we are giving charity, but this is going to be a very structured charity thing. And the added feature of this is we got trustees in this charity who are very reputed people, honest people, forthright people, people who are very conscious about the needs of the society, like Mr. Dharmakrishnan, who is the CEO of Ramco Siemens, and we got the Oduvar from Kapalishwara Temple, Sri Sargurunathan, and we got a patient, a loyal patient who has been with us for more than 20 years. We got thousands of them, but I just need to select a couple of them. Vidya Satish and Rajashekar, who is in the construction company, but they all have one common factor. They are all very worried about the society. They want to contribute to society in some way or other. So they are going to contribute in the form of their labor, their time, and whatever they are able to come by kind of raising funds for our charity, they will do it. So these are the trustees. And the other aspect is we are going to get ATG exemption, which means whatever contributions you give to the charity will be exempt from the income tax. So this will be an added feature for people who want to contribute for this trust. So basically this is meant to cater to the needs of the less privileged, the poor people, children who are coming from a single parent home. A lot of divorces are there. The husband is dead, mother is taking care of the children. Like that we deal with a lot of people, and so basically that's what our intention is, to take care of the poor.
That's wonderful.
And can I add one thing? this is English, I guess, but in Tamil, the most popular, the couplet, which is called a Tirukural, it says, Variyarku என்று ஈவதே ஈகை மற்றெல்லாம் குறியதற்பை நீரதுரைத்து, which actually translates into, whatever you give to the real poor is the real charity. Whatever you do for not so poor, the one who is well off, is not really a charity. You are expecting something in return from them and you are just doing it like a charity. This is what it means. So it has got a very deep meaning. It's only 2 lines, but it conveys so much.
Yeah.
That's what we want to convey.
Okay, that's amazing. Thank you so much for sharing that. So the second question is, what is your perception of an ideal asthma care center, and how would you describe your center and its services?
An ideal asthma care center should deliver scientific asthma care. They should have a precise diagnosis, and the patients should be received and attended immediately. A sick patient, asthma patient, who is struggling to breathe, cannot just wait in your waiting room without being cared for. As soon as they come to the center, somebody should, like a triage nurse, somebody should triage them and understand that they are in distress. Immediately they should have the oxygen saturation measured, they should get oxygen supplements if there is a need, they should get a nebulizer to relieve the bronchial spasm so they start breathing easy, and then they get the assessment with the lung function, and then they come to the doctor. I mean, they come to me here, and so the delay should be completely avoided, eliminated. That's number 1. And they should be assessed properly. The diagnosis should be established properly, and it should be a transparent care where we are able to tell the patient exactly what your problem is and what kind of treatment I am going to give, what kind of medicine this is, and what kind of side effect you can expect. All these things have to be explained explicitly, transparently. So, and on top of everything, this should be given in a setup where people are kind. The people who receive the patient should be smiling, pleasant, and show empathy, sympathy, and the guy who does the PFT should be efficient, should be properly trained, and the doctor should be well trained, experienced, and who really cares for the poor asthma patients. Does it tell everything about what you want to know?
Yeah, it does. Thank you. So the third question is the more serious. What do you think are some of the challenges in asthma management?
Oh, well, this is a very complex, very important question too, because asthma poses challenges in more than one way. First of all, asthma is not even diagnosed properly in most of the patients. If I have to quote Newsweek, which came about 2 or 3 decades back, the cover story was, not labeling a child with asthma as an asthmatic is a systematic conspiracy against children, which means not calling an asthmatic child as asthmatic and just say wheezy bronchitis, viral bronchitis, allergic asthma, allergic bronchitis. These are terms which should be completely avoided. A child with asthma should be labeled an asthmatic. This is number 1. So the challenges start from the diagnosis. First of all, you should have the right label. Number 2, they should have the right treatment. Most asthmatics, if I have to tell you the world literature, asthma is the most underdiagnosed problem. Asthma is the most undertreated problem. These are the slides I have been presenting for the last so many decades for the doctors. The third one is, asthma is probably the most common cause of admission in pediatric population, hospitalization, because they are not properly controlled, right? So, coming back to the challenges, asthma patients should be diagnosed properly and they should be given the inhaler treatment. The fact is, 7 or 8 out of 10 asthmatic patients, including children, they are not getting the right inhalers, not the right kind of medicine, not the right dose, or not the right kind of an administration. So all these things or in fault. These are the main challenges. Not diagnosing, not treating properly, not educating the patients. That's another thing. Because an asthmatic child, when you are treating, you have to educate the parents. The problem, Ramya, now we are dealing with a generation where we are treating the child, the parents are not involved in the care. Both are working. Usually the grandparents bring the child. And they are kind of old fashioned. When you say inhalers, the spacers and all, they are really baffled. First of all, there is a lot of resistance. My God, should I have to be giving these inhalers to my children? Like that, there is a barrier which you need to break. Then you need to educate them. Then you insist that the parents should come. At least one of the parents should come. You understand? So these are the real challenges that we face as a doctor who is doing asthma care for nearly more than 4 decades now. About 45 years I am doing asthma care. And these are some of the challenges. And then we will talk about challenges as we go, because after we diagnose, after we start treatment, then the questions come, oh, inhalers, these are dangerous. I'll get addicted to that. And you need to break all the superstitions. Again, please, let me quote Bharadiyar here. ஆயிரம் கோடி படைகொண்டு வந்தாலும் மாயையே நீ எந்தன் சித்தத்தெளிவனும் தீயின் முன் நிற்பாயோ மாயையே. This is what Bharadiyar, the great poet Bharadiyar says. You know what it means? We are shrouded by superstitions. In all aspects of our life, there is a lot of social superstitions, there are a lot of medical superstitions. One of the medical superstition is asthma is a disease that cannot be controlled, that cannot be treated right. Allopathy is not the way to go. Inhalers are dangerous, inhaled steroids are dangerous. All these are superstitions. But all these superstitions can be cleared by clear thinking, clear explanations. The patients having a very clear mind that they are getting the right message from the doctor. So Bharadiyar says all these superstitions are like a big enemy that you need to fight against. How do you fight? You know, if they are like cotton, you should be like a fire. You just burn the superstitions. That's what he says.
Wow, okay. That's
Right.
amazing. Okay, so you spoke about children. What makes asthma care so complex in children in particular? Could you expand on that?
Well, pediatric asthma is very difficult to diagnose for one reason. Many of the children with asthma do not present with the typical wheeze that the adults present with. There is something called a cough variant asthma, where children just come with a persistent cough, an annoying cough, a nighttime cough, a cough that's brought on by exertions like laughing, running, eating, like that. So, or a visit to the park, because there's a lot of allergies there. So, when you confront a child with a chronic cough, you should know that this could be asthma. This could be a cough variant asthma which needs to be treated as an asthma, not like just a cough. Okay, that's number one challenge. Number two, a lot of doctors, the primary care doctors, don't know that asthma can be diagnosed by doing a proper PFT. Any child more than 6 years, they can do a pulmonary function test. They can blow into a thing into computer, and then we can actually measure the lung capacity and everything. But they seem to get confused about primary complex. A lot of doctors are diagnosing asthmatic children as primary complex and put them through 6 months of treatment with anti-tubercular drugs. Primary complex is basically a milder version of TB. I used to tell in my interviews, primary complex is primarily a complex in the doctor's mind. Like superiority complex and inferiority complex, or a shopping complex. These are complex, and there is no connection between primary complex and childhood asthma, because in childhood asthma we don't have any features of primary complex. Primary complex patients, they don't cough, they don't have phlegm. Okay, all they have is fever, weight loss, failure to thrive. These are the features. There is no correlation, there is no commonality between primary complex and childhood asthma. There is no reason to get confused, but they do. This is important. And asthmatic children, most of the time they present with an infection. At the time they have some collection of mucus, and when they do X-ray, sometimes it can look like a pneumonia. It's not pneumonia, it's patches of collapsed lung. We call it atelectasis. So there are some patches, and the doctor looks at it and say, oh, this is pneumonia, and they are treated as a pneumonia. And when they keep on getting attacks of asthma again, they say recurrent pneumonia, like that. This label also goes. These are the common things I see. And to fight this only, we do so many continuous medical education sessions for primary care doctors. We are involved in continuously educating doctors about how to approach a child for asthma diagnosis. How do you treat asthma? How do you convince the parents? All these things are part and parcel of what we do towards continuous medical education. Well, I can go on and on, but these are just the challenges, but there are more challenges. Obviously, if I have to go through all these things, I will need about 2 to 3 hours of talks.
Okay. Yeah, I think there's so much that happens, and there you have so much information that you can, you know, give the audience, because
Yeah.
there's a lot of misconceptions about how
Right.
healthcare is.
Yeah.
So, yeah, and do you think that asthma isn't taken as seriously as it should be? Is the next question.
Yeah, I think still many patients think asthma is a disease that will just get better over years. Why patients? Doctors think like that. Doctors tell, oh, don't worry, when the child gets about 6 years, 7 years, he will outgrow asthma. But I have seen children dying at 6 months of age, 2 years of age, because their asthma was not diagnosed properly, was not treated properly. They got an acute asthma attack, and before they could get to the emergency room, they have collapsed and they have died because of respiratory failure and other complications, even a cardiac arrest because of low oxygen saturation. So if the doctors say, wait until 8 years, your child is going to outgrow, they are not saying the right thing. They are being very irresponsible. I'm not kind of blaming all the doctors. This has happened in my practice, and I have seen children dying, which is brought to my knowledge later. Those children who were advised to go on proper treatment were denied because some doctors have misguided them. So these are not taken seriously. Shocking stories of asthma deaths is real, and I got a couple of laminations in my clinic where it shows in what age people have died because of negligent asthma care. I have seen this here. I have seen asthma child, an adolescent, who was brought dead in Chicago, where I was trained from, Cook County Children's Hospital. Mr. Boy Jefferson is his name. It's still green in my mind. He was giggling and talking and joking in the school bus, and he was brought dead to our emergency room. These are labile asthmatics. They show deep variations. Suddenly they get very sick with their asthma. I'm not saying anything to frighten you. The intention of this interview is to educate you, not to frighten you. At the same time, அஞ்சுவது அஞ்சாமை பேதமை அஞ்சுவது அஞ்சுதல் அறிவார் தொழில். Again, this is a couplet, Tirukkural. Whatever you need to really worry about, whatever you need to really be afraid of, you need to. You cannot be foolhardy and say, that's not going to happen to me like that, and neglect. We have to prevent asthma deaths. That's our top priority.
Yeah, I think the main question that I have, which is not as part of the questions, a lot of people are not sure which doctors are giving the right medical advice because they don't have the knowledge, so they're trusting the doctors that they go to get that knowledge. But how do we differentiate a good doctor from a bad doctor, or a good diagnosis from a bad diagnosis?
Yeah. Basically, you are trying to say there is really the competent doctor versus the incompetent doctor. Instead of just good and bad, I will use this term. That's what you mean, I guess. See, my vision and my desire is, even a primary care doctor, like a pediatrician or a general practitioner, should be able to provide pretty decent asthma care to the patient that he is treating. That's the ideal situation. because as you all know, in India, there are not many specialists like pulmonologists or super specialists like allergists. There are mostly a lot of primary care doctors. So they should be armed, they should be educated, they should be informed about all aspects of asthma, so they are able to provide the best possible care to all the patients they receive, for the asthmatics I mean. And there are specialists like pulmonologists and people like us, allergy specialists, they are not in plenty. Okay? So the question is, we have to make them competent. We have to make them understand what is asthma, how to diagnose asthma, how to provide proper care, how to convince the parents. All these things should be starting from the grassroots education of primary care doctors. And a subtle, I would say, the difference, and that's also the main difference between the way we approach asthma from the way other doctors, including pulmonologists, approach asthma is they are focusing their kind of attention on the airway. The airway is going to spasm, the airway is inflamed, the airway is making a lot of mucus, the airway is twitchy and hyperreactive. This is how the pulmonologists are looking at asthma. Allergists like us, we say, yeah, all this is true, but the airway doesn't start in the lungs. The airway starts in your nose, right? This is where the air enters. So the problem is not only there, the problem starts in the nose and it's part of the sinus and then it goes into the bronchus. So you need to address the allergies and the problems of your nose and your sinus and the lungs comprehensively, collectively, holistically at the same time. Otherwise, you could never ever control asthma in full, and you can never give a 100% remission from asthma to those patients. This is what we feel we are doing the right thing. But patients are welcome to choose whom they want to take care of the children, but they should be informed doctors, they should be educated doctors, experienced the care of asthmatic care. Does it convince you?
Yeah.
Right.
So the final question is, what is your takeaway message to your patients or to asthma patients out there?
Well, I always insist that you should be armed with the knowledge, the parents and the patients, and they should have faith in the doctor, they should have faith in the medicines they are taking, they should have faith in themselves, and they should always feel that they should never become slaves to the disease. They should conquer the disease and lead a normal, productive, useful life. So don't let asthma control your life. For that matter, any disease. Don't let cancer control your life. Don't let depression control your life. You control your problems and live like an exemplary life, a full life. That's what I would tell my patients all the time.
Wonderful. Yeah, and it's actually on each of the sheets that you give your patients. I see that quote is mentioned at the bottom, so that's very nice. It's like a reminder for all of your patients.
Absolutely, absolutely. My last take-home message for this interview is patients who are listening to this, and even if you're not a patient, if you know people who are suffering from asthma, but they cannot afford proper asthma care because financially they are not well off, they are deprived, and they are not resourceful, kindly tell them that we are here. Our Karpaga Swasalaya's door is open for all poor asthma patients, and they just need to come with a problem. They don't need to come with money. We will take care of them. This is for sure. And this Swasalaya is started with this noble intention of providing asthma care for everybody, irrespective of their caste, creed, religion, nationality, nothing. there's going to be no barriers. எல்லோரும் எல்லாமும் பெற வேண்டும், இங்கு இல்லாமை இல்லாத நிலை வேண்டும். Everybody should get that. That is the idea.
Okay, thank you. Thank you so much. Thank
Appreciate
you for your time, Dr. Sridharan, sir. And thank you, all of you watching.
Appreciate it.
And we will be back with more interviews, more educational videos on asthma and allergy. And this is the Asthma and Allergy Resource Center run by Dr. Sridharan and his staff. Thank you so much. This is Ramya Ramsey signing off.
Thank you, Ramya. Thank you.